Napoleon wasn't the only person in his family to die after contracting COVID-19. An uncle and 5 cousins also passed away from it. Which brings up the question, why are some families affected by COVID so differently and disproportionately? Joining us now to talk about this is our Chief Health Editor, Dr. Nandi. Good evening, Dr. Nandi.
Good evening, Linda.
So you mentioned that there were many factors that play a role. So why is it that African Americans have been hit harder?
First of all, Sheriff Benny Napoleon was a great man and a respected law enforcement expert. My condolences to the entire family. First of all, they've really suffered. Besides the 6 family deaths that was just mentioned, Sheriff Napoleon's brother was also terribly ill with COVID-19 and in the hospital for 72 days. 36 of them were on a ventilator. Thankfully, he recovered. But back to your question, right? Why is it that some families are affected by COVID more than others? We've heard of lots of people not doing so badly. They have had hardly any symptoms. Well, there are many factors that play a role. In the U.S., data shows that more people of color seem to get seriously sick and die from COVID when compared to Caucasians. In particular, African Americans have been hit especially hard. Recent data from Harvard Public School of Health shows this very clearly. 1 in 875 African Americans died from COVID-19. Compare that to 1 in 1,625 white people. That's almost twice the death rate.
So, Dr. Nandi, some families might get sicker from COVID if, say, heart disease or diabetes runs in the family.
Yeah, absolutely. And diabetes can run in families. Obesity can too. And a person's risk of heart disease is higher if they have a history of it. In fact, heart disease is a leading cause of death for African Americans. So that could be why some families are hit harder, right? So I want to share an interesting case study of identical male twins with respect to this. 60 years of age with almost identical genetic makeup. Both of them developed COVID-19. Both ended up in the hospital. One of them was released after 2 weeks and the other was moved to the ICU, intubated and mechanically ventilated. So this demonstrates, even though we're talking about all these trends, that the virus can be very unpredictable. No one really knows how a body will react to this virus. So this is why we got to continue to be vigilant and protect ourselves. And when we can get vaccinated, we have to get vaccinated and protect ourselves.
And that's why it is so frightening, Dr. Nandi, as you said. You can't tell what's going to happen from one body to the next.
Yeah, and when we're looking for factors, right, is it that the load of the virus is going to make a difference? Are there genetic factors? There's so many, and income inequality, not getting access to healthcare. All these things are going to be important. But, we're still trying to figure all that out. What we do know is this. Number 1 is prevention. Number 2 is the biggest part of prevention is what? Doing all the masking and social distancing and then getting vaccinated when you can. There's so much misinformation. I want people to know that people can die from this, just like Chief Napoleon did. So we got to really understand that this can affect you.
Yeah, keeps getting harder. Dr. Nandi, thank you for giving us that update. Alan.
Well, Glenda, the clock